Hi guys, I'll be going over GABA. So what is GABA? GABA is a gamma aminobutyric acid, which is a naturally occurring amino acid that functions as a neurotransmitter. It transmits the messages within the nervous system. Specifically, GABA acts as an inhibitory neurotransmitter, which is similar to brakes on a car. It regulates the speed of information transmission as well as preventing overwhelming sensations. So, how does GABA work as an inhibitory neurotransmitter? So, GABA functions as a neurotransmitter in the brain. It plays a crucial role in inhibitory process within the central nervous system. It operates as the most prevalent inhibitory neurotransmitter. GABA interacts with two main types of receptors on nerve cells. They are known as GABA A and GABA B. When GABA binds to GABA A receptors, it triggers the opening of chloride channels. This then leads to a hybridization, and it reduces the likelihood of the nerve cells generating an action potential. Simultaneously binding to GABA B receptors, it initiates intracellular signaling events that modulates the cell's activity. Regardless of the receptor type, the overall outcome of GABA binding is a decrease in the responsiveness of nerve cells, which prevents the excessive transmission of chemical messages. This inhibitory function of GABA is partially noteworthy for its calming effect, since it helps regulate the nerve cells' hyperactivity that's associated with conditions like anxiety and stress. In essence, GABA acts to temper the excitability of nerve cells, which contributes to its role as a key regulator of neural activity in the central nervous system. So the knockdown of the GABA vigabatrin is that vigabatrin is a medication that seems to effectively prevent seizures, especially in individuals with tuberous sclerosis complex, which is a genetic cause of epilepsy. This drug works by increasing the levels of a neurotransmitter that's called gamma aminobutyric acid, also known as GABA, in the brain. GABA usually has a calming effect on the nerve cells, which helps to regulate their activity and reduce the risk of seizures. In the case of TSC, where seizures are often resistant to other medication, vigabatrin's unique effectiveness is thought to be connected to its impact on the GABA neurotransmitter. If you were to reduce GABA levels or interfere with its function, as might happen through genetic manipulation, it could potentially lead to an imbalance in neural activity as well as an increased susceptibility to seizures. So therefore, maintaining or enhancing GABA levels as achieved by vigabatrin, it appears crucial in preventing seizures and conditions like TSC. So this is the bond structure of vigabatrin. So vigabatrin, as I mentioned earlier, it's a drug that's used to treat epilepsy by inhibiting an enzyme called GABA-AT. This enzyme normally breaks down the inhibitory neurotransmitter GABA in the brain. By blocking GABA-AT, vigabatrin increases GABA levels, which enhances inhibitory signals and reduces excessive neural activity. The drug works by transforming into a reactive substance within GABA-AT's active site, covalently modifying a specific amino acid. This modification permanently deactivates the enzyme which prevents it from breaking down GABA. As a result, GABA levels rise in the brain, which promotes stronger inhibitory signals. This helps maintain a balance between excitatory and inhibitory signals, reducing the risk of seizures in epilepsy patients. So, Fibrobrichin's mechanism involves inhibiting GABA-AT, which allows GABA to accumulate and control neural activities. This makes it an effective treatment for epilepsy. Individuals' response and variance can influence this effectiveness. I hope my presentation made sense and you enjoyed it. Thank you.